Welcome aboard. Today, we're tackling one of the most frequent questions we get from home healthcare agency founders, executives, and tech innovators. How much does it actually cost to build custom home healthcare agency management software in 2026? With the global home care market expanding rapidly, agencies are hitting major roadblocks with outdated, rigid, off-the-shelf software. Whether you need automated scheduling, real-time caregiver GPS tracking, or customized Medicaid billing, off-the-shelf products often fall short. But building custom software is a serious capital investment. So if you are looking for a realistic budget, where does that number actually start? The short answer? A custom home health platform typically ranges from $40,000 to over $400,000. That massive spread depends almost entirely on the scope and complexity of your feature set. Let's break it down into three realistic tiers. The MVP tier is between $40,000 and $90,000. Taking about 3 to 5 months to build, an MVP focuses strictly on foundational workflows. You get basic caregiver scheduling, client profile management, mobile time tracking, and essential HIPAA security. It's ideal for a single location agency or for validating a new care model. The mid-range agency platform ranges from $100,000 to $220,000. This is the sweet spot for growing regional agencies. Built over 6 to 9 months, this tier introduces mandatory electronic visit verification, clearinghouse connections for direct insurance billing, family portals, and dedicated caregiver mobile apps. Building an enterprise and AI-driven ecosystem can easily exceed $250,000. Taking 10 to 14 months or longer, this tier is built for multi-branch organizations. It features AI-powered dynamic route optimization, remote patient monitoring wearable integrations, automated care plan adjustments, and real-time operational analytics dashboards. Now, why does health tech cost significantly more to develop than a standard corporate CRM or e-commerce app? It comes down to three massive factors: compliance, integrations, and mobile infrastructure. First, HIPAA and EVV compliance. You aren't just writing code, you're handling protected health information. Implementing end-to-end encryption, multi-factor authentication, audit logs, and state-mandated electronic visit verification adds about 20 to 30% to your core engineering budget out of the gate. Second, integrations. Connecting your software to clearinghouses like Availity for insurance claims, accounting suites like QuickBooks, or health data standards like FHIR and HL7 requires specialized engineering. Each custom API integration can add anywhere from $5,000 to $25,000 to build and rigorously test. Third, dual mobile apps. Caregivers in the field need reliable iOS and Android apps with offline functionality for rural areas, while admins need web dashboards. Building across multiple environments naturally increases development hours. Beyond initial development, you also have to factor in ongoing operational costs, what we like to call the post-launch stack. Post-launch maintenance role, as a standard guideline, budget 15% to 25% of your original build cost annually for software upkeep, hosting, and regulatory compliance updates. Here are 4 main recurring line items to keep on your radar. HIPAA-compliant cloud hosting, managed environments on AWS Healthcare Cloud or Azure typically run between $300 to $1,500 per month depending on data traffic. Annual security audits, independent third-party penetration testing, and vulnerability checks cost around $8,000 to $15,000 annually. Communication gateways, services like Twilio for automated SMS visit alerts and client reminders are pay-as-you-go expenses. Regulatory updates, state Medicaid rules and EVV requirements shift regularly, requiring ongoing software maintenance. So how do you keep your initial costs manageable without compromising on security or compliance? Start lean with a focused $50,000 to $80,000 MVP. Put it in the hands of your field nurses and schedulers, gather direct feedback, and expand from there. That wraps up today's breakdown. Best of luck building your software. See you soon in our next video.